Mr. Brown, I'm Analia. I'll be your student nurse today, and your doctor has ordered an NG tube to be placed. But before we get started, I need you to state your name and date of birth.
Logan Brown, 110598.
Okay, so I checked with his wristband, and that checks off. All right, so now I'm gonna set that up. All right, so what we're gonna be doing is we are gonna be placing a tube inside your nostril and go down into your stomach to provide you adequate nutrition and medication if needed. Are you allergic to anything?
No, I'm not.
Okay, and then do you have a nostril that you breathe better out of?
I breathe better out of my left
Your
nostril.
left nostril, okay. So I'm gonna tilt your head up to the high Fowler's position. And you said you're not allergic to anything, right?
No.
Okay, that's high enough. Alright, put that drill down. And I'll wash my hands again, and I will put my gloves on. Okay, and then I would have already prepared my station with all the tubings and saline and lubricant and all that ready to place the NG tube. All right, so before we get started, I'm going to place this draping underneath you just in case anything falls out. That's good. And then now I'm going to measure for placement of the NG tube. So I'm going to measure from his nose to his ear, okay, and then from the ear to the xiphoid process, which is about right there. I'm going to come back, place it right here, and I'm going to mark it with a Sharpie so we have the right placement. And then I'm going to put some lubricant on it, about 2 to 4 inches on there. There we go. And then I'm going to instruct the patient on how we're going to do this. There we go. All right. So I'm going to get you to tilt your head back for me. Okay. We're going to insert the tubing to this nostril. And then when we get to the pharynx, I'm going to have you tilt your head down. And I need you to swallow for me the whole way. Okay, so swallow, swallow, swallow. Quick procedure. Swallow, swallow. All right, and then when we get to the line, we're good. Now, if my patient was aspirating or choking or anything like that, I would immediately pull the tubing out for safety. And then now I'm going to place it with tape. Okay. And then I'm going to get my patient to look to that side, and I'm going to place it on their gown. And make sure we have some good tape to stick to our patient's nose. Okay, so we have it placed, and in order to make sure it's proper placement, we're going to get an x-ray to make sure it is down in the stomach and not in the lungs. But if we didn't have access to an x-ray machine, we would aspirate some stomach vial, and it should be like a yellowy, greenish, brownish color, and we would test it to make sure the pH was less than 5.5. Okay, so we have it placed, and everything's good. And after we have proper placement, I'm gonna put that into the patient's record, confirm it with the doctor, and then I see on the record that the doctor wants medication to be administered, so I'm gonna make sure it's the right patient, it's the right medication, it's the right dosage, the right time, and the right route, and the right reason, and then I'm going to document the correct medications. All right, so documented that, everything's good. I'm going to make sure he doesn't have any allergies. So you said before that you didn't have any allergies. You still don't have any allergies?
Nope.
Okay, and then that checks off on his record. All right, so first what I'm going to do is draw up normal saline, and I'm going to undo the tubing right here. Put it right there. Draw up saline. Not that much. And then I'm gonna insert it. There's the saline. Okay, and then I'm gonna drop the medication. Okay. Push the medication. Right, good. Then I'm gonna drop more saline, whoops, saline. And then I'm gonna administer it again. That way it flushes the medication down, okay? I'm gonna make sure I lock the tubing back. All right, I'm gonna make sure my patient is are you in any pain?
No, I'm not.
Are you having any discomforts?
I feel okay.
It's all good? All right, so make sure my patient is okay. I'm gonna lift the side rails back up and give my patient their call light. I am gonna leave them in high fellers or semi-fellers, and I'm going to make sure the bed is at its lowest level. I'm gonna leave, and when I come back to remove it, I'm gonna do the same thing. I'm gonna introduce myself. I'm gonna make sure it's the right patient, right date of birth, make sure they don't have any allergies, make sure they're not experiencing any pain. I'm gonna lift the bed again, I'm gonna put the side rails down, and I'm gonna start removal. Okay, so what I'm gonna do is I'm gonna start removing this side after I verified all that, verified it with the record. And I documented the medications and how much of everything was given. Okay, so what I'm gonna do is I'm gonna pinch this. I'm gonna tell my patient, okay, take a deep breath. All right, and I'm gonna just start pulling. All right, it's good. Pull it all out, and then I'm gonna dispose of it in the trash can. With my gloves. Out. And I'm gonna get rid of this. Pull, and then put the side rails back up. I'm gonna lower the bed. There we go. And make sure my patient isn't laying supine. Make sure they're kind of sitting up with this. And I'm gonna make sure they don't have any pain again. Do you have any pain?
Nope, I'm good.
Nope. Okay, and do you need anything? Anything else I can do for you?
I'm okay right now.
Give them their call light, make sure everything's good, bed's locked, and I'm good to go.